Hi, it's Dr. David Green, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. I'm here today with Ronnie, and she is a neuron, so Ronnie for short. And Ronnie has a developing problem, and that's called multiple sclerosis. Multiple sclerosis is a disease that afflicts the neurons by targeting the outer layer of the neurons, which is called the myelin sheath, okay? What do we do with myelin? Myelin is a insulator that helps with nerve conduction. So if Ronnie wants to emit impulses to her friends, it's very helpful to have that myelin sheath so that she's able to emit those impulses faster, so that, you know, the body that she lives in can react and do motor functions and things like that. With the autoimmune disorder that is multiple sclerosis, it eats away at the myelin sheath and then it exposes the axon. The axon can still function, but it doesn't have the insulation. So what patients will often start to experience is weird types of symptoms where they're losing their ability with coordination, ambulation, and it just gets worse and worse because there are no traditional medications that have been able to protect and restore the myelin sheath. Now, alternative treatments such as with stem cells and exosomes, absolutely. They've been shown in basic science and clinical studies to help restore and spare the myelin sheath so that patients can get better conduction. And here's an interesting thing. If the myelin's already gone completely, it's not going to restore the whole thing. However, it can protect the axon from irreversible damage. Because when the myelin's gone, the axon can still function to an extent for a period of time until it's irreversibly damaged. But stem cells and exosomes can help keep it functional. All right? So when you receive stem cells and exosomes for multiple sclerosis, we do a hybrid therapy. We do an injection into the back. It's called intrathecal, performed by our experienced anesthesiologist. And that allows us to get millions and billions of stem cells and exosomes around the blood-brain barrier to the brain and the central nervous system. In addition, we do IV, intravenous infusion therapy to help patients a lot as well. The combination is tremendous, and it can either allow patients, for a time, prevent the progression of MS, whether it's relapsing, remitting, or primary, and it can possibly show benefits. There are some really good studies starting from like 2009 and several since then showcasing the benefits with improved coordination, improvements in sight, energy, sleeping patterns, sexual function, lots of benefits that patients can see. More than the traditional treatment options that are available, which are typically immunosuppressive and oftentimes have way more risks than benefits. If you look at our YouTube channel, and we'll put a link in here to Mandy's success story for MS, she tried multiple traditional therapies, and they made her so much worse. They gave her psoriasis, it gave her optic neuritis, it gave her lots of things that she didn't even have before the treatment started. So she got much worse until she tried stem cell and exosome therapy. Now, what are the side effects? You may have something minor to moderate and temporary that we see at times, such as lightheadedness, dizziness, chills, maybe a low-grade fever, maybe feel like you have the flu for a day or two or three, and typically that's what we see. We've done over 27,000 stem cell procedures in the 8 countries that we're in over the past decade, more than any other regenerative medicine clinics. We're the world's busiest providers. And we've never seen a deep infection, we've never seen a rejection, and we've never seen a tumor. There's no exacerbation of cancers or causing a tumor. All right? Visit us online today at r3stemcell.com and then call us to set up your free consultation for potential treatment in Turkey to see if you're a candidate at +1 844 Get STEM, or email us at info@r3stemcell.com. That's what Ronnie did. All right, thank you.